morning, Nancy, Esther. I have visiting duty today.
Oh, you do? Lucky you.
When you first get to the facility, you're required to sign in or check in. In some cases, you'll be asked to sign in on a page in a logbook. It's always important to follow the rules or procedures of the facility you're visiting.
And these are the patients. We only have one today, huh?
Only have one.
Okay, let me get the details here.
When you get to the patient's room, use your discretion to ensure that you're not interrupting a private family moment or a medical visit.
Strawberry pizza.
May I come in?
Come on in.
Do you mind a visit from Mended Hearts?
Not at all.
Before you begin your visit, ask permission. Introduce yourself and verify that you're visiting the correct patient.
Mr. Beverly?
Yes.
Mrs. Beverly, nice to meet you.
Nice to meet you.
How are you doing, sir, today?
Just fine.
My name is Mike Donahue. I'm with Mended Hearts.
Explain to the patient that you've been through a similar experience and that you're there as a volunteer to encourage them and answer any questions.
We're an independent support group where people like you have had procedures ourselves. I had 9 angiograms over the past couple. Never had a stent like you have, you know. So, do you have any particular questions at all?
It's important to be a good listener. Good listeners pay close attention, listen with empathy, and are not judgmental. Be an active listener by paraphrasing what you heard the patient say or reflecting back the feelings the patient seems to be
If
expressing.
you want a good quality of life afterwards, like most of us have had, there are some things you're going to have to change and do in your lifestyle. One thing with a stent, of course, you know, the doctor's going to give you some medications, some pills. And in some cases, they use the pills to make sure that the stent doesn't close up. And you may have to be on that for a while, sometimes even for a lifetime. Some heart medications you need for a lifetime.
So I'm not completely fixed then.
No, sir. You know, after your procedure, you should have more energy. You should feel a lot better. Within 4 or 5 days, you should be able to get back to normal. But there are things that you should be doing that we're going to recommend for a change, some of which are involving nutrition and exercise and diet changes.
Ask the patient if they have any questions.
Any questions on these matters?
Well, I have been a couch potato for some time now, so it looks like that's going to have to change.
Well, a little bit. What we would recommend, and talk to your doctor about this, cardiac rehab. I mean, the easiest exercise is just walking in a mall for 30 minutes a day. But cardiac rehab is the best because you have a nurse there and they check your blood pressure and you do all the right exercises to make you stronger and feel better quicker. Your recovery is quicker if you go into cardiac rehab. Your question is, you know, what's life like afterwards? We have this brochure, and I'll give you the package before I leave. Tells you all about life after angioplasty. Tells you all the things that you can expect. Mrs. Beverly, you're going to do the cooking, I
Yes.
assume? See, my wife and I, we take turns cooking. But you may have to get a heart-healthy cookbook. That's probably be very good for you. Right?
We'll invest in one.
Yeah, and you know what got me in here was sausage, cheese, and peanut butter. That's going to have to go. You know that? Okay, sir? You understand that?
Yes.
But this you should read. This is very good for you. And it tells you all the things about medicine, exercise, what to do. Again, mindful of the fact that you're not cured. Now, when it comes to medicine, with medicine, you know, you should know what each one does. I mean, there's so many different types of medicines you have, like the medicine for your stent keeps the stent open.
Remember that it's important not to give medical advice.
You should really know what each one does. And you know, you can get that from your doctor. You can get it from your pharmacist. And when you get your medicines, you know, you get that sheet with everything on it, which scares you.
Yeah.
It scares me too. That'll tell you exactly what the medicine's for, when you're supposed to take it, what the best time is. In fact, what I do is, because I tend to forget taking my medicine, when and where and how is to get it, go to the store and get a pill case. There's all different kinds for weeks, days, months, And that way you can help him organize his pills,
Okay.
And what I do is we put them out for the whole week, and then you take them out each day. Another system is 3x5 cards. Each time during the day would list all your medicines. So many times I've wondered if I took that medicine or not, or took too many of them, to be honest with you. So get a pill case. Okay.
Try to get the patient to talk. Ask questions to open or continue a conversation. Remember that your best role is that of a listener.
Sometimes you're symptomless. I was symptomless until indigestion. Did you have any symptoms?
You
You did, huh?
know, indigestion that you just mentioned,
Oh,
I tended to ignore it.
yeah, me too. We live in denial, right? Like, I'm too busy today. I got too much to do to worry about a heart attack. So that's good. So if you get a doctor's prescription or walking, and that'll help you too. And you know about medicines, and keep your doctor's visits. That's important because you have to monitor your cholesterol and all of that blood work as you're going along. You don't want to forget about it because it's a silent disease and it sneaks up on you. Right? And you could probably help a man with his medicine list.
Yes, I can.
What I do is I make out a computerized list and I stick it on the side of the refrigerator with all my medicine on it. And then when those lovely emergency technicians come in, they got a list right there and off they go. My wife has one in her pocket too.
Oh, okay.
If I could give you a few tips,
Sure.
When he takes a nap, you take a nap. When he eats, you eat. Because the last thing you want is to have two people down at the same time, then nobody gets better. Shut the phone off in the bedroom too.
Okay.
Okay, now, Mr. Beverly, we have a reply card in the package.
The reply card is a self-mailer to Mended Heart's national office to help determine program needs. It is then returned to the chapter.
Ma'am, perhaps
Thank
you
you.
would take it for him?
Yes, I will.
And
Tell me as briefly as you can how you happen to be doing what you're doing.
I retired and I said, what am I going to do? And then I went to a Mended Hearts meeting, and a gentleman came along who happened to be the president and said,
Cath
Why
lab
don't you learn
visits
how to
are
visit?
often
I'll show
shorter
you
than
how to
hospital
visit.
visits
Okay.
because the patient
Here
is
I am.
not in the facility
We
for
have
very long.
volunteer times, we have
But a good visitor takes cues from the
small
patient
business
about whether to continue or end a visit.
When you get ready and a doctor says you're okay, we have meetings every month in the hospital, free to attend.
I'll
Okay.
look into that.
When the visit comes to an end, thank the patient for his or her time.
Thank you, sir, and thank you for letting me come in and spend time with you, and my best wishes.
I thank you for sharing
Thank you.
your time.
Thank you. Nice meeting you.
Thank you, ma'am.
Once the visit is completed, make sure to follow the facility's sign-out procedures and complete a Mended Hearts accredited visiting record.
Okay, thank you. Have a good day.